Well, there's no need to panic. Reports of human metapneumovirus HMPV overwhelming Chinese hospitals have sparked concerns about a potential new health crisis. However, health experts assure that HMPV is a familiar virus, typically manageable and not a cause for alarm. Ramon Gordon caught up with one of the best in public health and files this report.
Reports of a virus overwhelming Chinese hospitals have sparked fears reminiscent of the early days of COVID-19. Public health expert Professor Peter Figueroa has moved to allay concerns, seeking to quiet the online rumor mill now in overdrive.
There are reports of HMPV, human metapneumovirus. This virus is known to us. It was first identified in 2001, and it causes a common cold.
The Chinese Center for Disease Control and Prevention says most cases are linked to seasonal influenza or the flu. However, a spike in the human metapneumovirus has raised global concern, with cases reported in Malaysia and India.
I guess following the COVID pandemic, people are anxious whenever they see an increase in cases like this. But it's usually not severe. It's usually not serious. You just have runny nose, stuffiness, a little fever, maybe sore throat, cough, and you just use whatever preparations you use for the common cold. You use it for this virus.
Public health experts say HMPV, unlike COVID-19 during its genesis, is a well-known virus that typically increases in prevalence during the winter. Young children and adults over 65 are at particular risk of severe complications.
Now, a small number of children and persons who are immune deficient and the elderly, when they do get this virus, they can get a pneumonia, or they can get ear infections, or it can aggravate asthma. So a small proportion of people who get infected may have a severe disease.
Meanwhile, hospitals in the U.S. are grappling with a surge in respiratory illnesses, including flu, COVID-19, RSV, and neurovirus. Regions like Southern California and Wisconsin are reinstating mask mandates, with health officials urging the immunocompromised to wear masks in public spaces. The advice echoes overseas recommendations and aligns with Professor Figueroa's call for vigilance.
If we see someone who is coughing and sneezing, then we keep our distance, or we always try and cover our face, our nose and mouth when we're coughing or sneezing, and then you keep washing your hands. Always. Frequent hand washing is important. But at this point, I don't think we need to worry about it.
Local health officials have not yet issued an official statement on the matter. However, sources indicate they are monitoring developments closely and will provide updates to the nation if and when necessary. Ramon Gordon for CVM News.